Chest pain is it's a very tricky type of a symptom, and that a lot of people have. A lot of people, when you talk to them about chest pain, you ask them if they have chest pain, they say, no, I don't have chest pain, but I have chest pressure, or I feel tight in my chest, or I feel, some kind of a discomfort in my chest, or burning in my chest. Any of those things, we as physicians, ER physicians, we consider everything under the umbrella of chest pain. And we take all the chest pains very seriously, especially in adults or over 45 years old, in males, and 50 years old in females, because a very simple chest pain could be a sign of a heart attack, sometimes the other way could be a very severe chest pain could be a sign of just maybe a little infection in the lungs or inflammation in the lungs. So it's a very broad umbrella that needs to be assessed and evaluated in the ER, especially, like I said, in older adults especially adults that have other medical problems like diabetes and high blood pressure. The diagnostics for chest pain is, again, it depends on the age group. If it's somebody who has had a lot of risk factors, which we consider smoking, history of high blood pressure, history of diabetes, obesity, or family history of heart problems, then we take that very seriously. And usually what we do is we do a whole slew of blood work on them. We check their cardiac enzymes, we check their electrolytes, and then we do chest x-ray and EKGs on them. And most of those patients end up being admitted to the hospital because a lot of times just doing that, the one set of blood tests does not really tell us much about what's causing the chest pain. So we have to repeat the chest, keep them in the hospital, repeat that blood work, and possibly for patients that we really suspect that could be a cardiac issue, do stress tests and further studies at the hospital once they get admitted. Now, there's a lot of patients that, the story that they tell you about the chest pain, the way they feel the chest pain, the severity of the chest pain, all those things are taken into consideration. And if you look at their EKG and looks like they're actually having an active MI, which is basically a heart attack, we have to rush, obviously, those patients to a cardiac cath lab.